Good. My name is Dr. Dewan S. Raja. Today I will discuss about compartment syndrome. Compartment syndrome is a medical condition that occurs when increased pressure within the confined muscle compartment impairs circulation and tissue function, leading to ischemia and potential necrosis. Muscles are arranged in groups. So we have muscle compartments, muscle groups in limbs are organized into compartments, each enclosed by rigid, non-expansile fascia. Fascia is a tough fibrous tissue layer surrounding and separating muscle group. The fascia are connective tissue. These are tough fibrous tissue layer surrounding and separating muscle groups. Bones also help in the formation of the muscle compartment, forms part of the compartment boundary by in areas like forearm and lower leg. We have also interosseous membrane between the bones in the forearm and in the leg. So we have also intermuscular septa in the muscles in the arm, also in the thigh and other part of the bodies. So this is a section of the upper part of the leg. We are seeing two bone, tibia and the fibula. We have muscle compartment by fascia. Okay. Anterior group of muscles here. Like the tibia, this anterior extensor, extensor digitorum longus here. Okay. And on the lateral aspect, we are getting the fibularis longus, also called peroneus longus. And this is the neurovascular bundle. This is also bounded by the bone here. We have also interosseous membrane. We have fatty tissue a little bit here and blood vessels in other compartments here. And here is another neurovascular bundle surrounded by the fascia. Those supply these muscles. Okay. So here is the nerve artery present, like nerve and artery, like tibial nerve, the posterior tibial artery. Here is the deep fibular nerve, anterior tibial artery. Okay, so if there is any type of damage, fracture, or overuse, there may be collection of fluid, there will be edema that will compress this structure. Okay, that will cause this muscle to be necrosed. Eventually they will go through ischemic changes, nerve supply will be disturbed, and there will be damage to the muscles. Okay, this is a section here, this is that section, this section is here, this section is here. Anywhere we have compartment, and compartment structure may be compromised due to damage, collection of fluid, edema, or bony fracture. Okay, so suppose if we have a fracture here, then the common fibular nerve will be involved. The deep fibular nerve will not function. The anterior tibial artery will be compressed. The venous return will be jeopardized. So muscle will go through necrosis and ischemic changes in necrosis. Like here is the anterior tibial artery, deep fibular nerve. This is the common fibular nerve here. Okay, so this is the superficial fibular nerve. So everything may be damaged. Muscle will be out of blood supply and nerve supply is possible depending on the impact and size of injury or the extent of injury. Okay, we got that. Compartment syndrome, common location, anterior, lateral, superficial, posterior, and deep posterior compartment of the leg. So lower leg, it may be possible. Maybe in the upper leg, not necessarily lower leg. It may be in the upper leg, lower leg. We can take out this word, the lower. Okay. It may be leg anywhere. Okay. It may be leg anywhere in the leg. Okay. So we got that. So forearm, flexor and extensor compartment, thigh, foot, hand, gluteal region are less commonly affected. Each compartment contains vessels and nerve. This structure, artery, vein, and nerves, are vulnerable to compression and ischemia. Causes increase intercompartmental pressure. Causes include fracture, crash injuries, overuse, repetitive exercise, prolonged compression, vascular causes like reperfusion injury after ischemia. Reperfusion should be done very gradually. Okay, tight dressing or cast, and it may be the complication of snake venom. Okay, that causes a lot of edema and also lot of hemorrhage. Okay, increased pressure collapses vein, venous return diminishes, reduces capillary perfusion leading to tissue hypoxia, cycle of ischemia and edema. Hypoxia, there is lack of oxygen, causes muscle and nerve injury. Cellular injury lead to fluid leakage and swelling. There will be edema and exacerbating pressure. Okay. Neuromuscular damage, nerve ischemia can occur 2 to 4 hours, leading to sensory motor deficits. So action should be taken very quickly. It should not be delayed more than 4 hours. Muscle ischemia begin 4 to 8 hours, resulting in necrosis and irreversible damage if untreated. Limb dysfunction or amputation, that is taking out a part of the limb. In severe cases, systemic effects, prolonged ischemia and muscle necrosis release myoglobin into the bloodstream. This can lead to rhabdomyolysis. Skeletal muscle cell will be lysed or disintegrated. Acute tubular injury and systemic complication like shock or multi-organ failure. Severe pain often out of proportion to the injury, unrelieved by analgesia. Suppose there is injury to the upper part of the limb, the or lower part of the lower leg or upper part of the lower leg, then dorsiflexion, plantar flexion will cause severe pain. Okay, like pain exacerbated by passive stress of the muscle in the compartment, like plantar flexion or dorsiflexion. Paresthesia, tingling or numbness signs, tense swollen compartment, reduced or absent pulses. So person has anterior compartment syndrome of the leg. We may not get the dorsalis pedis artery pulsation. Person has compartment syndrome in the posterior part of the leg, then the posterior tibial pulse may be absent. Okay. Pallor and paralysis indicate late or advanced stages. Diagnosis of compartment syndrome. Okay, how can I diagnose? Clinical suspicion is crucial, particularly in the presence of high-risk injuries. Compartment pressure measurement. Normal pressure is 0 to 10 millimeter of mercury. Compartment syndrome pressure is greater than 30 millimeter of mercury or within 30 millimeter of mercury of diastolic blood pressure. Other imaging tests, not diagnostic, but may help identify fractures or other underlying causes. That is X-ray, MRI. We can diagnose the tissue damage, the bone fracture. Treatment is fasciotomy, emergent surgical compression by a surgeon, a licensed surgeon, by cutting the deep fascia longitudinally to relieve pressure. thus decompressing the area and prevent anoxic necrosis of the muscle. Supportive care, manage underlying cause, fracture stabilization, address systemic complications like acidosis or rhabdomyolysis. And that's all about compartment syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.